breaking news from News 8.
Well, good afternoon. New York State pausing the use of the Johnson & Johnson COVID vaccine today after a call to pause that vaccine came down from the CDC and FDA. Those two agencies are looking into 6 reported U.S. cases of a rare and severe type of blood clot in people who received the vaccine. Of those 6 cases, one was fatal and another patient is in critical condition. The agencies say until their review process is complete, a pause should be put in place out of precaution. As of today, nearly 7 million doses of that J&J vaccine have already been administered in the U.S. Now, local doctors urging the public not to panic over this morning's news. Kayla Green joining us live with more on what they have to say. Kayla, good afternoon. Easier said than done for people when they hear this news. What are doctors saying?
Good afternoon, Mark. Yes, Dr. Mendoza and other local doctors, the message from them today is that this is quite literally a 1 in a million event. Dr. Ed Walsh from Rochester Regional Health says people who received this vaccine in the past 3 to 4 weeks should monitor for symptoms just in case, but says even his own son got this vaccine recently and he's telling him not to panic. Now, Dr. Walsh says the evidence shows the clotting issue affecting primarily people under age 50 with low platelet counts. He says the 6 patients with these rare blood clots have experienced persistent headaches and abdominal pain. He says, unfortunately, headaches are common in both vaccinated and unvaccinated people, but the CDC recommends people who have received the J&J to monitor symptoms carefully. Dr. Walsh also emphasizes these blood clots have occurred in close proximity to each other, and people who were vaccinated months ago appear to have no risk. He says it's common to be in this position with a new vaccine or medication, and the FDA keeps track of small, rare side effects. He again reminds people this is incredibly rare.
But it is a difficult situation where you have risk-benefit. Clearly, the risk of dying from COVID far exceeds the risk of dying, say, from one of these very rare 1 in a million events. I wouldn't lose any sleep over it. I would pay attention to symptoms and not ignore them should you have them. And I think that the rarity is something that, I think should give most people reasonable reassurance that they'll be okay.
Dr. Michael Mendoza says the county is working to switch people scheduled for the J&J to the Pfizer or Moderna and will be notifying people as they work that out.
This has occurred in an extraordinarily minute percentage of the people who have received the vaccine thus far. There is a good possibility that these women might have developed the blood clots even without getting the vaccine. We just don't know. This should not be viewed as a reason to not get vaccinated. The risk of serious illness or death from COVID-19 for you or a loved one is higher than the risk of serious illness or death from the available vaccines.
Dr. Walsh says this will inevitably slow down the road to herd immunity and encourages people to get one of the other 2 vaccines. Neither of them have been associated with this rare side effect. Live in Rochester, Kayla Green, News 8.
Kayla, thank you so much. And to reiterate, doctors say if you've received the Johnson & Johnson vaccine within the last couple of weeks, monitor your symptoms, and if you have concerns, contact your physician. Well, elsewhere today, if you have an appointment at a state-run vaccination site, you will receive the Pfizer vaccine in place of the J&J vaccine or the Moderna one. Several local clinics that were planning to administer the Johnson & Johnson vaccine are now canceled and put on pause as well. That includes student clinics at SUNY Brockport today and tomorrow, Nazareth College, St. John Fisher College as well. Wegmans canceling all of its Johnson & Johnson vaccine appointments, including today's clinics set for the Wegmans Conference Center. Now, the pause is having an impact on Wall Street on this Tuesday. A live look at the big board, the Dow down just over 100 points, so not a significant setback on the street, but worth noting, the Dow down just over 100 points in live trading here at the noon hour. Well, this is the latest setback for Johnson & Johnson. You'll recall recently about 15 million doses of its vaccine were destroyed because of human error at a Baltimore plant. That error brought production levels down by nearly 90% for the pharmaceutical company.